Welcome to Kellie's News You Can Use, a podcast dedicated to healthcare information. Hello, and welcome to Kellie's News You Can Use podcast. Today we have Dr. Adam Littman, a board-certified orthopedic surgeon with over 16 years of experience. Welcome, Dr. Littman.
Morning. Thanks for having me.
Sure. We're delighted to have you. I know you have a very busy schedule, so we'll get right to it. Can you share a little bit of your background, and we'll go from there?
Sure. So as you mentioned, I'm a board-certified orthopedic surgeon. I've been practicing in South Florida for about 10 years. Prior to that, I did my medical school at Jefferson University in Philadelphia. Following that, I did my orthopedic surgery residency at the NYU Hospital for Joint Disease, which is a top 3 hospital for orthopedic surgery, but also for orthopedic training in the country. And then I went to Pennsylvania Hospital in Philadelphia again to do some additional training in both joint replacement and sports medicine procedures.
Wow, that's quite a resume. Can you share with us your expertise in orthopedics here in South Florida?
Sure. So as an orthopedic surgeon in South Florida, my practice primarily consists of sports medicine procedures, so injuries or chronic degenerative changes of the shoulder, hip, and knee. And that involves anything from tendon or ligament reconstruction all the way through joint replacement.
Oh, wow. And what I want to talk about next is robotic surgery now in orthopedics. I looked up some data in the 1980s. Somebody had a total hip replacement. Their average length of stay was about 10 days. And now in 2025, it's 1 to 3 days, which is incredible. Can you walk us through how that robot works? I've been in the OR. I find it fascinating. So walk us through, that pre-op, and then when you, as a surgeon, how you control that robot, just a little synopsis of how that works for our residents.
Sure. So the data you give is very interesting. Even in the early days of my training, patients would stay 3 to 5 days in the hospital after surgery. Even before that, people would come 1 to 2 days before surgery. Now, I would say 70% of our patients that are appropriate are going home the same day. So they come in the morning and they go home within a few hours. And part of what can make this possible is using the Mako robotic arm system, which is a technology that assists surgeons such as myself in enhancing our precision and our accuracy during the total knee replacement procedure. So the Mako involves a few key steps or stages. It begins with a preoperative planning where we obtain a CT scan of the patient's entire leg, including their knee, to create a 3D virtual model of the patient's joint. We then use this personalized model to create a surgical plan with precise measurements for the implants that we're going to be using. And then during the surgery, the robot uses this plan to assist us in making the bone cuts and soft tissue balance the knee so that the implant alignment and placement is specific to the patient. And ultimately, the combination of all of this leads to, in my experience, a better outcome and a faster recovery.
Wow, that's fascinating. It's incredible, the strides. I know my father even had spine surgery. He was out within a day. So it's fantastic. I did, and we talked a little bit before we started taping. I'm kind of a health junkie. So one of the information articles that I looked up and was reading was this minimally invasive shot called the viscosupplementation. And I found it extremely fascinating. Can you start with what that is and why it would be used?
So viscosupplementation is a gel injection that we provide in the office It is part of the conservative management of knee arthritis. It is only FDA approved for knee arthritis, although it can be used off-label for other joints. And it is basically a concentrated form of hyaluronic acid that gets injected into the knee. Hyaluronic acid is a naturally occurring substance in our body, and it's a key component of joint fluid. And essentially, we're giving it to patients at very high doses to act as a lubricant and a shock absorber, thereby reducing inflammation and improving mobility.
Are there certain people that are the best candidates for this, or, age or any other health issues that might prevent them?
Sure. So it's typically indicated for people with mild to moderate arthritis. It's usually a second line treatment, meaning it's used in patients that have already tried and failed cortisone injections, people that have already tried and failed oral medications such as anti-inflammatories or acetaminophen, Tylenol, and can be used after trying physical therapy as well. It can also be used as a substitute in patients that are diabetic or patients that can't have cortisone, and can be very effective in those populations.
And is it covered by insurance or most insurances?
I would say most insurances do cover the injection. There are some that don't. You'd certainly have to check with each individual coverage provider. There are frequently co-insurances that patients need to pay, and that is variable. But most insurances do cover it on some level, and most will cover it every 6 months.
Oh, wow. And how often would a patient need to receive this shot?
So just like any injection, the results are variable. We have patients that unfortunately don't receive much benefit from it, and I have plenty of patients that have had it performed and don't do it again for 2 to 3 years. So it is variable, but I would say for patients that it's working on, every 6 to 12 months is common.
Okay. So with some other questions that I wanted to kind of follow up with is to kind of proactive when it comes to joints. Are there things that individuals, in particularly older individuals here at John Knox, our residents are so active, from riding bikes to pool, water aerobics to they even do hot yoga. I mean, it's endless, the activities here. How or what type of activities or exercise would you recommend to help people keep their joints healthy?
Sure. So to begin with, activity is good for joints. Activity is good for arthritis. The idea of don't move and it won't hurt actually doesn't apply. We want your residents and we want people with us to move. Now, the type of movement is important. Typically, we recommend low impact activities. So as you mentioned, water aerobics, water exercise is a great way to move your joints without the weight of the body, and that can reduce symptoms and reduce progression of arthritis. Cycling is another great activity, the elliptical. Running, jumping, other high impact activities can certainly be more problematic with aggravating symptoms or causing more rapid progression of arthritis. And those would typically be things I would recommend patients avoid.
Excellent. Thank you. That's very helpful. Now, before we wrap up, there's a few other questions I have. Is one, where do you perform your surgeries? What hospitals are you affiliated with? And then the second part of that question is, where are your offices located?
Sure. So I perform my joint replacement surgeries, which includes robotic knee replacement at Broward Health North, which is on Sample Road. We are one of the first hospitals in South Florida to have the Mako robotic system. We also have the latest version of it, 4.0. So we're one of the first hospitals in Florida to actually have the newest version of it. We've been performing robotic joint replacement for about 10 years there, which is really since the infancy of robotics. So we're very well versed in it. And we also do perform joint replacement, anterior hip replacement, and shoulder replacement at the hospital as well for those patients that have other arthritic issues at other joints. And as far as my offices, we have an office in Boca Raton on Military Trail, and we have another office on Cypress Creek Road in northern Fort Lauderdale.
Great. Well, I really appreciate you taking time out of your very busy schedule to have this quick talk with us and to learn more about orthopedics. And I appreciate it. Thank you. And until next time, everyone, have a good day.